As we age, our bodies face a constant battle against the natural deterioration of vital functions. This is an inevitable law, but the speed and extent of this deterioration can be controlled and significantly slowed down through a scientific diet. In the treasure trove of precious foods that nature has bestowed, salmon has emerged as a leading superfood, an indispensable ally in the journey of taking care of the health of the elderly. The power of salmon does not come from a single ingredient, but from the combination of a superior combination of nutrients, especially omega-3 fatty acids, high-quality protein, and rare micronutrients. The first part of this analysis will delve into the two most fundamental and important benefits: protecting the cardiovascular system and nurturing a sharp mind. Cardiovascular system, a strong shield protecting the weak old heart. The cardiovascular system is often the first line of defense against the effects of aging. High blood pressure, atherosclerosis, dyslipidemia, and the risk of stroke are constant threats to the health and lives of older adults. Salmon, with its rich omega-3 content, specifically the two fatty acids eicosapentaenoic, EPA, and docosahexaenoic, DHA, acts as a multifunctional shield, protecting the heart from many aspects. The mechanism of action of omega-3 on the cardiovascular system is a typical example of the sophistication of nutrition. First, it helps regulate blood lipids effectively. In the elderly, the concentration of triglyceride, a type of bad fat, in the blood is often high, which is the main cause of atherosclerotic plaques that narrow and harden the artery walls. EPA has been shown to significantly reduce the production of triglyceride in the liver. At the same time, omega-3 also tends to slightly increase HDL cholesterol, good cholesterol, which is responsible for cleaning LDL cholesterol, bad cholesterol, out of the blood vessels, preventing their accumulation. This process can be likened to sending an elite army to clean the blood pipes, keeping them clear and elastic. Second, omega-3s have a natural blood pressure-lowering effect. High blood pressure in the elderly is a common problem, putting enormous pressure on the blood vessels and heart muscle. EPA and DHA promote the production of nitric oxide, NO, in the body. Nitric oxide is a powerful vasodilator, helping the arteries relax and widen, thereby reducing the pressure of blood flow on the blood vessel walls. Omega-3s have remarkable anti-inflammatory and antiplatelet properties. Chronic low-grade inflammation is at the root of many diseases of aging, including cardiovascular disease. Atherosclerotic plaques are not just a buildup of fat, but also a source of inflammation. Omega-3s inhibit the production of inflammatory molecules such as cytokines and eicosanoids. At the same time, it reduces the stickiness of platelets, preventing them from clumping together to form dangerous blood clots, the direct cause of heart attacks and strokes. In addition to omega-3, salmon also provides a significant amount of potassium. Potassium is an essential mineral that helps balance the body's fluids and counteracts the negative effects of sodium, salt. By helping the body excrete excess sodium through urine, potassium plays an important role in controlling blood pressure. The combination of omega-3 and potassium in salmon creates a comprehensive, dual protection mechanism for the cardiovascular system. 2. Brain, golden fuel for cognitive activities. If the heart is the engine, then the brain is the control center of the body. Cognitive decline, from simple forgetfulness to serious neurodegenerative diseases such as Alzheimer's and dementia, is the biggest fear of aging. Once again, salmon proves its irreplaceable role in protecting and nourishing this complex organ. The main fuel that salmon provides for the brain is DHA. About 60% of the brain's dry weight is fat, and DHA accounts for a very large proportion of it. It is a basic structural component of nerve cell membranes and the myelin sheath that surrounds nerve axons. DHA can be thought of as high-quality bricks that build the brain's house. When there is a DHA deficiency, the structure of nerve cells becomes loose and unstable, directly affecting the ability to transmit signals. In the elderly, adequate DHA supplementation helps maintain the integrity and flexibility of nerve cell membranes, ensuring that nerve impulses are transmitted quickly and accurately. This is vital in maintaining memory, learning ability, and information processing speed. In addition to its structural role, DHA also promotes synaptic plasticity. This is the ability of nerve connections to form, strengthen, or weaken over time, which is the foundation of learning and memory. DHA supports this process, making the brain more flexible in creating new memories and retrieving old ones. Furthermore, neuroinflammation is considered one of the main factors driving the progression of Alzheimer's disease. Amyloid beta plaques and tau tangles in the brains of Alzheimer's patients are always accompanied by a strong inflammatory response. Both EPA and DHA in salmon have strong anti-inflammatory properties, helping to extinguish this smoldering fire in the brain, slowing the death of neurons and protecting cognitive functions. Many large epidemiological studies have shown a strong correlation. People who regularly consume fatty fish have a significantly lower risk of Alzheimer's disease and dementia. Finally, we must mention astaxanthin, a carotenoid that gives salmon its characteristic pink color. Astaxanthin is a powerful antioxidant that can cross the blood-brain barrier, a property that not many antioxidants have. It helps neutralize harmful free radicals, protecting nerve cells from oxidative stress, another factor that contributes to brain aging. The combination of DHA, EPA, and astaxanthin turns salmon into a nearly impregnable fortress, protecting the brain from the attacks of time and disease. 3. Starting around age 40, the body begins to lose muscle mass, a process known as sarcopenia. This accelerates as we age, leading to weakness, reduced balance, and an increased risk of falls. The main weapon against sarcopenia is protein. Salmon is a source of high-quality protein, containing all the essential amino acids that the body cannot synthesize on its own. More importantly, the protein in salmon is easily digested and absorbed, which is extremely important for the weakened digestive systems of older adults. Getting enough high-quality protein helps stimulate muscle protein synthesis, making up for lost muscle mass, thereby maintaining strength and mobility. Preventing osteoporosis. Brittle and easily broken bones are a concern, especially for postmenopausal women. Calcium is the main component of bones, but for the body to absorb and use calcium, it needs an indispensable companion, vitamin D. Sunlight is the main source of vitamin D, but the elderly often go out less, and the ability to synthesize vitamin D through the skin also decreases. Salmon is one of the very few natural foods that contains significant amounts of vitamin D. Vitamin D acts as a key, opening the door for calcium to pass from the intestine into the blood and then attach to the skeleton. Without enough vitamin D, calcium supplements are almost useless. By providing both protein, necessary for bone matrix, and vitamin D, necessary for mineralization, salmon plays a dual role in building and maintaining strong bones. Reduces inflammation and joint pain. Arthritis, osteoarthritis, and rheumatoid arthritis cause severe pain, stiffness, and limited mobility. As mentioned in Part 1, the powerful anti-inflammatory properties of omega-3s, EPA, and DHA are a godsend for arthritis sufferers. They work by inhibiting biochemical pathways that produce inflammatory substances, prostaglandins, leukotrienes. Regular consumption of salmon can help reduce pain levels, reduce morning stiffness, and may even reduce the need for nonsteroidal anti-inflammatory drugs, NSAIDs, which have many side effects on the stomach and kidneys. 4. Vision and skin, windows to the soul and protective barrier. Aging also leaves a clear mark on the eyes and skin. Salmon provides specialized nutrients that help protect the windows to the soul and maintain the health of the body's protective barrier. Protect your eyesight. Age-related macular degeneration, AMD, is the leading cause of blindness in people over 60. The retina, especially the macula, is home to extremely high concentrations of DHA. DHA plays an essential role in maintaining the function of photoreceptor cells. A deficiency of DHA can increase the risk of developing AMD. In addition, the antioxidant astaxanthin in salmon once again proves its superior value. It has the ability to accumulate in the retina, helping to protect eye cells from damage caused by blue light and oxidative stress, reducing the risk of both AMD and cataracts. Omega-3 also helps improve dry eye conditions by increasing the production of oil in the tear film, keeping the eyes moist and comfortable. Maintain healthy skin. The skin of older people is often dry, thin, and prone to wrinkles. Omega-3 helps strengthen the skin's lipid barrier, retaining moisture and preventing water loss, making the skin softer and more elastic. Its anti-inflammatory properties also help soothe skin conditions such as eczema and psoriasis. Astaxanthin, with its powerful antioxidant properties, helps protect the skin from the harmful effects of ultraviolet UV rays from within, reducing the formation of age spots and wrinkles caused by the sun. Mind and immune system, the invisible foundation of health, improves mood, fights depression. Depression isn't an inevitable part of aging, but it is quite common. There is growing evidence of a link between low omega-3 levels and an increased risk of depression. EPA appears to be particularly important in mood regulation. It can influence neurotransmitters like serotonin and dopamine, which can improve feelings of well-being and reduce symptoms of depression. Boosting the immune system. The immune systems of older adults tend to weaken, age-related immunodeficiency, making them more susceptible to infections. Salmon provides many important micronutrients for immune function. Vitamin D is not only important for bones, but is also a powerful immune modulator. Selenium, a trace mineral abundant in salmon, is a component of important antioxidant enzymes and is necessary for the functioning of immune cells. Omega-3s also help regulate the immune response, preventing it from overreacting and causing harm to the body. Part 3. Conclusion and in-depth explanation. Maximizing benefits from salmon, 700 words. Through 2 detailed analyses, it can be affirmed that salmon is not simply a delicious dish, but a strategic and comprehensive investment in the health of the elderly. It does not affect any single organ, but creates a resonance effect, a multi-layered protection network from the heart, brain, motor system to vision and spirit. This combined strength comes from the harmonious coordination of unique nutrients that few foods can match. In-depth explanation. Nutritional synergy greater than the sum of its parts. The real value of salmon lies in the synergistic effect between its components. The health benefits are not a simple addition of omega-3 plus protein plus vitamin D. Instead, they interact and amplify each other. For example, consider bone health. The vitamin D in salmon helps with calcium absorption, but the skeleton, bone matrix, is made primarily of collagen, a protein. The high-quality protein in salmon provides the amino acids needed to build this matrix. So protein and vitamin D work together to create a skeleton that is both strong from the minerals and flexible from the protein matrix. Similarly, consider brain health. DHA is the building block of neurons, but that construction and maintenance requires energy and protection. Astaxanthin acts as a sentinel, protecting DHA bricks from free radical damage. EPA is like a fire brigade, putting out inflammatory fires that could derail the entire structure. Without any one of these, the protection is significantly reduced. In particular, the role of astaxanthin should be re-emphasized. This is the hidden gem of wild salmon. It is one of the most powerful antioxidants in nature, hundreds of times stronger than vitamin E. Its unique ability to cross both the blood-brain barrier and the blood-retinal barrier allows it to exert a direct protective effect on the 2 organs that require the highest antioxidant protection, the brain and the eyes. This is an advantage that very few nutrients have. Practical recommendations to maximize benefits. To turn the above analysis into specific actions, The elderly and their families need to note the following points to maximize the benefits of salmon. Reasonable dosage. Reputable health organizations around the world often recommend consuming at least 2 servings of fatty fish per week. One serving is equivalent to about 100 to 120 grams. With this dosage, the body will be provided with enough omega-3 necessary for protective functions. Choosing salmon. Wild salmon, such as sockeye, coho, king, tend to have slightly higher levels of omega-3s and naturally occurring astaxanthin than farmed salmon. However, farmed salmon, Atlantic salmon, is still a great source of nutrients, is more accessible, and is more affordable. The most important thing is to be consistent in your consumption. Optimal cooking methods to preserve precious omega-3 fatty acids, which are sensitive to high temperatures. Gentle cooking methods such as steaming, baking, quick pan frying, or soup making should be preferred. Minimize deep frying at high temperatures as it not only destroys omega-3 but also creates harmful compounds. Important note: mercury. Salmon is a large fish, but fortunately is at the bottom of the food chain, so it has very low mercury levels and is considered safe for regular consumption. Drug interactions. Because omega-3s have a mild blood-thinning effect, people who are taking anticoagulants, such as warfarin, Coumadin, or antiplatelet drugs, such as aspirin, clopidogrel, should consult their doctor before starting fish oil supplements or increasing their salmon intake suddenly. In summary, incorporating salmon into the weekly diet of older adults is not only a smart culinary choice, but also a strategic nutritional intervention. It provides a comprehensive, natural, and effective solution to combat the negative effects of aging, helping to protect the heart, nourish the mind, strengthen the musculoskeletal system, and improve overall quality of life. Investing in meals that include salmon is investing in years of healthy, clear-headed, and joyful aging.